William, hopefully your favorite videographer from Two Hats Publishing. I welcome you to another Two Hats special of community events. Let's look in and see what's really happening. Another Tops adventure.
Huh?
Another Top adventure.
Yeah, so if I could get you to sign in for the media, that would be great.
Alright, find something for you. Sign or print?
Just print as we go.
I understand that. Oh, okay.
Es que tenemos un programa para todos y hace muy corto. Pero después de eso.
That's not right.
Thank you very much, William.
Are you here for the healthcare event? Yes. Okay.
Are we going to have speakers and stuff like that?
Oh yeah, no, it's going to start at 11:30.
So,
I think
I'm not late then.
No, you're right on
Like
time.
a healthcare enrollment event.
Wow.
I really
I'll see if I can set up and stay out of everybody's way.
Nada más si puede tener un poco de paciencia y después sí va a tener la oportunidad para hacerlo.
And they're not gonna want to wait.
Yo sé porque ella está second day.
Because she was a patient.
There he is, working too hard.
Yeah, not too bad. Easy right now.
Oh, all right. We've got Visual Publishing.
There's a sound system, translation for the Spanish speakers.
Fantastic.
There's a program translator.
Fantastic. All right. Tell me what we're doing here. I mean, it's got to be a great opportunity.
Yes, it is. Today, Texas Organizing Project is holding this event to give service to the community in registering, applying for the Affordable Care Act so they can get health care insurance coverage. And so that's the basic goal. And there may be other agencies who can assist in whatever is available other than the Affordable Care Act. That's for social services, etc.
I was wondering, can you ask a kind of a technical question?
Yes, go ahead.
All right. I've been hearing rumors that people who are on disability and maybe Social Security are not, they cannot get insurance through the Affordable Health Care Act.
Well, the guideline is if someone has Medicare coverage, Medicaid coverage, veterans coverage, employer health coverage, they do not need to go to the Affordable Care Act. They already are covered. This is intended for the 6 million Texans as well as for the close to 40 million nationwide population that does not have any coverage under any one of those, whether it's veterans, Medicare, Medicaid, or employer health insurance. So that excludes the rest of the population by virtue of having other ways to be covered.
Basically, it's for the people who do not have any coverage at all.
Exactly.
Wonderful. Thank you.
We think so. Thank you.
Get ready, get ready, get ready. It's time to speak out and sign up. Good morning, everyone. Good morning. It's great to see you here today. I am Reverend Larissa Tyson. I am a member of Texas Organizing Project, better known as TOP. Well, what is TOP. TOP is a member-run, member-driven community nonprofit that fights for issues that impact the low to middle income families across Texas. For over a year, we have been fighting for affordable health care for all of Texas. And we will continue to fight until we get the victory. We want to take the time out to give a big thank you to all of the organizations and public officials here that helped make this day possible. First, Dallas County Judge Clay Jenkins, is he in the house? Come on, let's raise it. Foremost Family Health Care at Martin Luther King Center. Planned Parenthood of Greater Texas, are you in the house? The Dallas AFL-CIO.
¿Usted oye? No se le entiende, sí, hay mucho ruido, mucho ruido.
Dallas WIC.
Como que necesita hacerse más para allá.
All right. The Baylor Diabetic Health and Wellness Institute. Yay! And the Dallas County Election Department that will be registering voters. How many of you have not registered to vote? All right, then she will be over there to register you to vote. But our mission today is to try to get as many people as possible registered for affordable health care. But how can we do that? We need your help. Inside of your folder, there's a TOP membership card. Look in your folder and pull out the card. You ask, how can you help? This is how you help. By joining the fight, by joining Texas Organizing Project to help move forward. Complete this if you want to become a member of Texas Organizing Project to help fight for affordable health care along with other community needs. Our mission is to strive once again on behalf of the Texas Organizing Project. We welcome you here today, and we now will have Pastor Arnold Cannon to come and lead us into prayer. Thank you, and God bless you.
We all bow your head, please. O eternal God, our Father, as we assembled this morning, we hear there's pain in the land. There are people hurting, God. We can hear the pain of a single mother looking in the eyes of her baby, wondering how she's going to get the money to pay for the medication. We hear, dear God, the pain of a senior citizen who is trying to figure out how she's going to pay for care fare and a medication at the same time. There's pain in the land, oh Father. But we have come together this day as one, united to undo an injustice that has been in the land for so long. We come this morning, dear God, as one, united and thanking our president for courageous and bold leadership in passing through the Affordable Care Act. And we know, oh God, that there are those that are opposed to it, but just like you knocked Saul off his feet, we are asking, Lord, to knock those who are opposed to this plan, opposed to this legislation, that are opposed to this groundbreaking program to knock them off their beast too, so their eyes would be open and to see the pain of their constituents. So we come this morning, dear God, thanking you for those that have come out this morning. Thanking you, dear God, for their dedication. Thanking you, dear God, that they no longer are going to stand on the sideline as spectators, but are going to get in the game and be participants. This is our prayer. This is our hope. Hear us, oh God, this morning. And then when that day comes, we can truly say that justice roll down like waters and righteousness like a mighty stream. We ask this in the name of our Lord and our Savior Jesus the Christ. And all those that believe say amen. Amen. Amen.
How many of you are excited about health care? How many of you are excited to have health care? Well, I'm excited. So at this time, I would like to introduce to you Mr. Eugene Kennedy, who is a representative from Foremost Family Healthcare Center here at Martin Luther King. Put your hands together as you come.
Good morning. I want to say welcome on behalf of Families Foremost, formerly known as Martin Luther King Health Clinic, and our CEO, George Tapley. Thank you for coming today. We have a lot of people in the back ready to help you. We're going to get as many people enrolled today as possible. We're going to do everything within our power to ensure that you have a successful day. We're not going to waste your time. We're going to get you in and get you out. The process is a little long, so be patient with us, but we're going to do our part to get you in and out. Thank you again for coming. Have a great day.
All right, thank you guys. Now at this time, I'd like to introduce to you an elected official, our Dallas County Judge, Clay Jenkins. A round of applause, please.
Good morning. Good morning. I'm so glad that you're here. TOP is an incredible organization. This is a great turnout for this event. We've had about 113,000 patients so far in the Dallas area sign up for Affordable Care Act insurance as of last Thursday. And it's our hope.
Fold them up separately and then stack them up, put them on the table.
50,000 families will have the opportunity to get insured through this program. Health insurance is so important. We have people that go to Parkland and other places for their health care, but they don't have health insurance. And although they can get health there, that is not the same as having your own doctor and having preventative health care. So this is an opportunity to get really good insurance that covers a whole host of things. Having a baby, mental health care, rehabilitation from an accident, prescription drugs, and to do that for a very affordable cost. So to give you kind of a flavor for that, a 27-year-old that makes, say, $25,000 a year can get really good insurance for $74. A family of four that makes $50,000 a year can get good insurance for $26 a month. Now, some people don't make enough money to qualify for a subsidy because Governor Perry turned down Medicaid expansion.
Yes, he did.
And I will be working with TOP. TOP is very outspoken and working to try to make sure that we get that Medicaid expansion.
And y'all need to get his ass out of there.
But for those who qualify for a subsidy, today is a great day to take advantage of that and to change the future for your family by getting good, affordable health insurance. I want to say one other thing to you before I get away from here. If you are registered to vote, but the name on your voter registration card is different from the name on your driver's license or your ID card, go ahead and get with the people at Dallas County Elections. We can help you with that. We can change your voter registration card so that they will match exactly, and it will be easier for you to vote. One last thing. There's a reason why, for those people that fall into the Medicaid expansion, which is 133,000 of us here in Dallas County, who don't qualify for subsidy but aren't insured. There's a good reason for that. These aren't people that don't work. These are people that don't make enough money to qualify for those subsidies because Governor Perry and Attorney General Abbott created this big hole for those people. So there are things that we can do that you can do and I can do. One of the things that I can do is I'm asking our Commissioners Court to ensure that every person who provides a service to Dallas County, whether they work for any other company, that they pay their employees at least $10.10 an hour. All right? One of the things that you can do is you can organize with groups like TOP, and you can go door to door and talk about the issues that are important for our community. Because the big special interests, they have millions of dollars to spend to keep wages low and to keep health care out of our grasp. What we've got are our feet and our voices and our relationships with our neighbors. By the way, if you know anyone who doesn't have health insurance, you're all leaders or you wouldn't be here. So I'm asking you also to lead people that you love to get health insurance. Have that talk with your grandson, your nephew, your niece, your neighbor. Give them the opportunity to get health insurance. It can change your life. God bless you.
All right, thank you guys very, very much. As you can tell, we have very much a packed house here. And so at this time, I want to introduce to you a gentleman who you may have seen on Univision. Perhaps he is a top member, a top leader, has played a pivotal role in our healthcare campaign. Please help me in welcoming Mr. Luis Veloz.
I heard somebody say my name. Thank you for welcoming me. Buenos dias. Good morning to everybody. My name is Luis Veloz, and I am a top member and a top leader. Now, as a top leader, I know what it's like to not have health insurance for most of my life. I know what it's like to have a family that is $250,000 in debt with the hospital. And I also know that it gets better. I remember, as if it was yesterday, October the 1st, I went to Parkland Hospital and I enrolled in affordable health care. I signed my application, I filled out my paperwork, and now months later I stand before you as a young adult of 20 years old that has health insurance for the first time in his life. Now I want you to do me a favor, please. If you want to have health insurance, please raise your hand. Good. If you want to have affordable health insurance that is of high quality, please raise your hand. One last question. If you think healthcare is a human basic right, please raise your hand. Good. Unfortunately, there are those that disagree with you. Our current governor, Governor Perry, and the person running to replace him, Greg Abbott, disagree that humans have the right to health care. And in doing so, they have rejected billions, not millions, billions of dollars to expand Medicaid in our state, leaving over a million of Texans without health insurance. Now I have some bad news for you. We've been talking about access to healthcare, access to affordable healthcare today, but unfortunately, some of you, once you have filled out the application, will find out that you will not be getting access to health insurance today. Some of you will find out that you are Medicaid eligible, which means you would have gotten free government insurance but will no longer get that because our governor said no. Some of you will leave knowing that as much and as hard as we organized, as much and as hard as we tried, you still do not have access to health insurance because of our governor. But see, there's a beautiful thing about living in a democracy. There's a beautiful thing about living in the United States of America. That beautiful thing is we can change that. This November, our governor is up for election. Our attorney general, our lieutenant governor, they're up for election. And we can elect people to work in Austin that will be fighting for us and not against us. Now I know what you're thinking, because it's the first thing I always get. I'm just one vote. One vote will not make a difference. One person cannot change who's going to be in Austin. You're right. One person can't do that. But many people can. That's why we're here. Texas Organizing Project is here to help you organize. In the legacy of Dr. King, he organized thousands, millions of people to fight for their rights. Now we're going to be organizing to make sure that your rights are not taken away, that your access to health insurance stays. But it starts with speaking to your neighbor, with speaking to the parents, with speaking to your children. It starts at home, and it builds, it grows in a community. So I need you to do something. Open your folder really quickly. You're going to see this page. At the top of the page, there's an event. Get Going with TOP. In that event, we're going to teach you how to effectively organize, because there is a way to organize. We're going to teach you how to do the same thing that Dr. King did many, many years ago, but in your community, in your neighborhoods. I need you to do another thing. You see this right here? Please hold it up. If you are interested in making a difference in your community, I need you to fill this out. Once you filled it out, please give it to anybody with a top shirt. So you see those top shirts right there? Find a person that has one of those shirts, fill this out, check the second box, and give it to them. And one final thing. If you are interested in becoming a long-term fighter, if you're also interested in schools, jobs, education, fill this out so we know that you're in it for the long haul. Now to start enrolling, coming back to the event, we have 3 steps. You're going to pre-screen, you're going to talk to your navigator, and then you're going to talk to an organizer. Those are 3 things that you will be doing today. And the reason why we need you to talk to an organizer, such as Brave, please raise your hand, is because we need you to know what's really going on in our government. Because unfortunately, that's something that we don't find out a lot about. One last thing. When we work with each other, we can do so much more than fighting alone. When we work with our communities, when we work with our neighbors, when we work with our brothers and sisters, we can make change happen. We can make change happen lots more than we can if we just do it ourselves. Look around you. Everybody here will be fighting with you, myself included. We cannot fight for you, but we will fight with you. And in the words of the great Dr. King, keep hope alive. Thank you.
So I kind of hate to follow that speech because that was pretty awesome, wasn't it? Give me another round of hands. Woo! 20 years old. 20 years old. So I am here to deal with the boring housekeeping stuff. I'm going to tell you how things are going to work. Everyone has a yellow ticket. Look at the last 3 numbers of your ticket. That is your number, and it's based on when you came in. I will come over here, and I will call for a group of people, and we will head over to that side. There's some blue tape along the floor. try to make a line approximately like that. We've got a bunch of volunteers that are going to help you sign up for a healthcare.gov account. That'll make it faster once you get to the navigator. They have signs. They will raise their signs when they are ready for someone. Some of them say English, some say English and Spanish. If you can, if you know that there's some Spanish speakers in the line behind you, if you could let them have the Spanish-speaking volunteers, that would be lovely. Once you've got your account, you come back here. We will be calling people, again, in smallish groups to go back to the navigators. And we're going to appreciate your patience. It may be a long wait, but how many of you have been waiting for health insurance for 5 years? How about 10? 20? How many people here is this going to be the first time in your life that you're going to be properly insured? All right, there's at least a few of you out there. It's worth it to wait for a couple of hours to do this, and I am so thrilled that a lot of you are going to be walking away with health insurance. And I'm going to tear up, and I don't want to do that because I have to run things. Well, run part of this thing. So just keep an ear out for when we call your number, memorize your number so that you recognize it when we call it, and just come and go wherever it is that we guide you to go, and we're going to get a lot of you signed up. All right. Woo! Woo! All right, I'm going to start out. Numbers 1 through 20.
This is William, hopefully your favorite videographer from Two Hats Publishing. I hope you enjoyed this video. If you like it, please leave comments below, or like, follow, or subscribe to us and get notices of all our videos. We love it, even when you call.